Please join me in welcoming Ms. Uttara Bharath Kumar, Senior SBC and Capacity Strengthening Advisor for Johns Hopkins University CCP. Ms. Kumar has over 27 years of experience in the field of health communication and behavior change. Currently, the Senior Social and Behavior Change and Capacity Strengthening Advisor on the USAID Global SBC flagship program, she has been with Johns Hopkins since 1997. She's currently based in Chennai, providing regional technical expertise and support to programs in Asia and Africa. She's an experienced trainer and has led as well as co-facilitated a number of leadership and strategic communication workshops globally on behalf of Johns Hopkins Training and Capacity Strengthening Division. She's also co-founded Nalamdana Are You Well, a Chennai-based health communication NGO in 1993 with a seed grant from the Echoing Green Foundation and was its executive director until 1996. She continues to actively serve on Nalamdana's board of trustees in an honorary capacity and provides technical guidance and fundraising support to their projects. Ms. Kumar, it's an honor to have you with us today. Over to you, ma'am.
Thank you very much, Yamini. Welcome, everybody. Good morning. And I feel very honored to be the first presentation kicking off this very useful, interesting, what promises to be a very enlightening workshop. And now in our new virtual world where everything seems to be online and one series of Zoom calls after another. So I will try to keep this as interesting and entertaining as possible. And let me just share my screen. There we go. I hope everybody can see it. If you can't, please just put a note in the chat box. So before I start, I wanted to introduce one of my colleagues, Sangeeta Agnihotri, who is the Deputy Director of the Center for Communication and Change India, CCCI, which is based in New Delhi. She has been a co-facilitator with me training in a number of workshops, and she was going to assist me in answering some of your queries that you might have popped into the chat box since we are very short and tight on time. So Yamini, maybe you could make Sangeeta a co-presenter so she can also access the questions in the chat. That's okay.
Yes, ma'am. I'm just doing that. Yeah.
Thank you so much. Sangeeta, are you on? There's so many participants I can't see.
Yes.
You must be. Okay, great. Fantastic. So let me just start without delay since we have a short time together and I'm trying to cram a lot of thoughts or ideas to provoke your thinking in this short space of time. I wish we had a chance to get to know each other because there's so many of you and I can only imagine the kinds of amazing and wonderful things each of you is doing. I would love to know, but this is a short time that we have together. So let me start with this question, which actually Yamini had started to answer already, which is what do we want to change? Why do we want to change behavior at all? And I think this really people's behavior would be nobody's business if it didn't have an impact on public well-being, whether it's public health or environmental outcomes or whatever it might be. And today we're going to focus our thinking on COVID-19, which is we've been thinking about practically nothing else for the last so many months. And whether until the time now when we have a vaccine, which by the way is still not widely available, behavior was literally the only vaccine we have. And now with the coming of the vaccine, behavior is going to continue to be an issue when we're thinking about uptake and compliance and vaccine coverage and so many other things. So I think we're all here at this session because we agree that behavior change is important in moving several public health and social agendas forward. And given that we're starting with that, a common understanding, I want us to think about potentially 10 tips. I could give you a lot of different ideas, but I thought it's best to stick to 10 today and share some thoughts on what we have found over the last year of doing public health programs around social and behavior change programs, communication programs around COVID-19, 10 ideas that might be useful to consider or have worked. And I will start with the first one. My first idea I want to posit is that communication is all about relationships. And what do I mean by that? When you're trying to influence behavior, it's not just the delivery of messages. We're not just trying to get messages to people top to bottom and say, here's the information, go and act on it. That's not how it works. Who conveys that message? What relationship there is between the conveyor and the person receiving the message, the intention, the quality of that relationship, whether it's positive or negative, all of these, the history of that relationship can all have a bearing on how the message is received, how it's internalized, and how it might be put to use. So communication is all about relationships and not just the delivery of messages. This is my first suggestion. And here are some world leaders, and I think you will agree, I'm not passing any judgment on anybody. I just want to say that they have all handled coronavirus pandemic in very different ways, in their own styles, in their own, with their own ideology, and the way their own relationships are with their people of their country, their own belief in the virus or its danger or any of those things. But how people in their countries have received and acted on the information has greatly depended on the relationship they have with this leader and the relationship or the effect the leader has had on them in the past. So this is something I just wanted to put out there to see the differences in how countries have done and how much that has to do with leadership. Leadership is a relationship too, whether it's spouses. So, I mean, just to go back to say, you're much likely to internalize a piece of information that is given to you by a friend or a colleague or a family member who you care about or you have a good relationship with, than something you just hear on the radio or someone just sends to you, or a pamphlet you might pick up. Trust is another big part of it. And this can also work in the opposite way. If there's a relationship that you don't trust, if there's somebody you don't believe in or don't have a good relationship with, the chances are that even if the information may be correct, if it's coming from a person you don't trust, you may not actually internalize that information or act on it. So communication is all about relationships. And it's no longer viewed as linear, but multi-directional. And what I mean by that is, in the old days, it used to be very much the dispensing mode, where whether it's in a school classroom or whether it's in health education, it was a doctor imparting information to patients or teacher giving information to students, and the receiver would passively receive it. But you'll know, and we know, that it's not true anymore. It comes from all directions. Information and content is now generated by the people who used to be the recipients. So you have things like Wikipedia, you have things like social media, where people who receive also create content. So information moves in multiple ways. And we have to keep that in mind when we are looking at how we take information across. The third, also, when we're talking about social media, I want to raise this point about misinformation, rumors, and how rumors can be generated at any level by anyone now. So it's not just good information that can be conveyed, it can also be negative information. And social media has made it go viral now. I don't think there's a single person on this call who has not received a WhatsApp call with misinformation during the pandemic, or an elderly relative or friend telling them, oh, have you heard about this, about the coronavirus, which is really not true. So on the left-hand side here, left-hand to me, I have this WhatsApp that was forwarded. I think many of you may have even received it, and there were so many more like it, talking about all kinds of misinformation and how to get rid of the virus. But that same viral ability of social media has also been harnessed positively by, credible sources of information like WHO that has talked about, do you have questions about COVID? Creating a small, simple infographic that's shareable by social media. So it can be used for the good and the bad, but the importance is really recognizing how this virus works and doesn't work, and how it can use the same viral property in social media for the positive or the negative, and understanding this, and that relationships also, like WHO is a credible source of information, and if your aunt sends this information to you, okay, she may be a credible source of information, and the aunt will say, oh no, this was sent to me by my friend whose friend is a doctor, and that person sent it to me, and therefore it must be true. So these are relationships, right? So relationships, communication, very important. My second point is that not everyone has the same information needs. And what do we mean by that? One size doesn't fit all. We have to always keep our audience at the center of our approach. We often tend to design communication and messages on a desk in an office with some colleagues, sitting in a lab, but not how often do we truly engage the audience and understand what it is like to be them. And then we will really understand how this information can be useful to them, or how the information may be packaged to be useful for them. Because one thing is very true about human beings: we don't do anything unless there's something in it for us, or we find this useful for us in some way, right? Even charity, I would argue, we do it because it feels good, right? Or we feel it's the right thing to do, or we care about what others think. There's always something. Almost nobody does something for absolutely no reason other than the fact that somebody told you to do it, right? So there's always something in it for us. And so how do we understand what's in this behavior? If I do this behavior, how will I benefit? And you won't understand that unless you're really in the audience's shoes. What do we know about the audience's environment? Their education, access they have to information or services or anything. What do we know about their cultural context, their belief systems, values, etc.? Who are their key influencers? Is it their best friend? Is it their teacher? Is it someone a religious leader? Is it a community leader? Who is it? Who are they distrustful of? What are their priorities, goals, and aspirations? So these are just some examples. I mean, we usually talk about thinking about audiences as women of reproductive age, men who are educated and urban between the ages of this and this. Those are demographic classifications. That doesn't really give you a sense of who this person is, right? So if you may really want to get into to understand your audience a lot better in order to be able to design communication programs for them. And we found this true globally when designing programs around masks and how to wear masks. People believe different things. Some people don't wear masks because they don't think it works. Some people don't believe in the virus. Other people don't have access to masks, clean masks. Other people may say it's expensive, I can't afford it. Another group of people may say, I don't look cool if I wear it. My friends will laugh at me. Other people may say, well, it's uncomfortable. I can't breathe in this thing, right? So there's so many different reasons. So just telling people to wear masks may not get them to wear it, because you have to really address what their issue is with wearing a mask if you want to change their behavior, correct? Young adults, for example, we're talking about teenagers, young 20s, feel invincible. They feel they're at low risk. Even if they get it, they won't die, right? And how do we then convey to them that they should still follow protective, preventive behaviors? How do we tell them that this is important for multiple reasons, not just whether you're low risk or not? So here's an example from the US where an advertisement was created for young people just to get them to understand. This piece of communication understood what some of their behaviors are and their beliefs, and got into their shoes. So here's a picture. It says, this guy is having dinner with his grandmother later. The other guy has COVID-19 but doesn't know it yet. The third fellow has an undiagnosed heart condition, right? Social distancing during a pandemic saves lives. Stay at home. So now when a young person looks at this ad, they're like, oh, wait a minute. It may not be what I think it is. It may be more dangerous. So this is taking it the next level. It's more than just having a young person saying, come wear a mask, right? It gets at what their underlying issues are. So some simple tips for audience-centered communication. Listen and listen carefully. Take people's perspectives into account. Acknowledge emotions, fears, anxiety, sadness, other things that are going on with people. Don't minimize those emotions, because acknowledging them then makes them feel like they've been heard and they will listen to you more. Focus on social responsibility and family ties. People do care about that a lot, particularly in countries like ours. Promote relatable role models. Show ordinary people following the right steps, right? Not necessarily always celebrities, because sometimes celebrities are great. They can get people's attention on a particular issue, but they may not be relatable. right? My life is not exactly like Amitabh Bachchan's life. But that's important because he plays a role in bringing attention to an issue. But when you want someone to say, okay, this guy is just like me, or this woman is just like me, and she uses a mask, even though she thinks it, it's difficult to breathe, she still uses it because she wants to protect her family. Then I feel like, okay, maybe I can do it too, right? So modeling behavior through relatable role models. Engaging credible champions and opinion leaders who are in your community, people who are believable, who people already have a trust with. And then using channels that have built trust over time. For example, you have community meetings, you have religious spaces where people meet, you have school boards and school meetings where parent-teacher associations. There are lots of different fora or like channels, even certain television or radio or social media channels that people already have trust in. Using the already trusted channels to put information into would be a better way than just generally scattering information, because that's a waste of time and money. And finally, sticking to simple actions of what they should do, why they should do it, what's in it for them, when and how to do it. Okay, so this is like simple, doable actions that you can include so people know what to do. So the third one, human behavior is complex. When we think about if you tell them they will do, it's really not that way. I think we all agree. And those of us that have children know that that's true too, that you tell them something, it's not like they're going to listen right away. Human beings are just grown-up children. I mean, adults are just grown-up children. We do the same thing. It's not always rational. We don't always behave rationally. So even when information is available, people may not hear it, see it, believe it, or agree with it, or feel that others might judge them. So there are multiple reasons when, even though they receive the information, they may not act on it. Messaging alone does not work. There's usually a gap between exposure to information and behavior. And what do we mean by that? This is something called the hierarchy of communication effects. It's an interesting and simple way to explain how that if you assume 100% of the people have been exposed, only a small percentage of them may act, because not everybody was actually exposed. For example, all of you listening on this webinar, some of you may have been checking a message, some of you may have been called by somebody else in the room, your attention may have wavered during a very important point that I was making. So even though I thought 100% of you was exposed, only 80% of you may have actually been truly exposed or truly paying attention. And of that, only a proportion of you would have understood what I'm saying, because maybe I'm speaking very fast. Maybe I'm being very, I'm talking about something you already don't believe in. There could be multiple reasons. I haven't simplified the concepts. Maybe there's, so understanding is an even smaller proportion of exposure. And the smaller proportion of that is approval. So even though you understand the message, you may not approve of it. For example, wear a mask. You understand what they're saying. You've heard it and you understand it, but you may not approve or agree with it, right? So there's a smaller proportion. And the even smaller group of that actually intend to act. So I may have been exposed to the message about mask wearing. I may understand why people are saying wear a mask because it protects you from the virus, and it's a barrier, etc., etc. I may approve. I may even say, yes, I agree, this is a good idea to wear a mask. And I may say, yes, I intend to act on it, meaning I agree that it's good to wear a mask, and I actually intend to wear a mask. Now, from that, it's an even smaller group that actually acts on it. Intending to wear it and actually wearing it, there may be still a gap. You may forget, you may run outside without it. We've all done this, right? So this is true of any health behavior, and it's been true even in the COVID circumstances. You go to some place, you intend to stand 6 feet away from somebody, but as time goes on, what happens? You start getting closer and closer. So, or you take off your mask after a little while. So acting on it and sustaining that action is even another step, right? So this may sound or look depressing, but truthfully, what we can look at and think about is that if we are better about our communication at every level, we make sure people are exposed and are interested. Yeah, our information is captivating, attention-getting, and interesting. It's clear so people understand. We are persuasive so people approve. And then we motivate people to act, right? And then when they act, we give them reasons to continue to stay in that behavior. So all of these are ways in which we can improve the hierarchy of communication effects and increase the number of people who are exposed to actually act. So this is a public communication campaign in Ethiopia on COVID-19. And what they did was they used multiple different channels to get at people, not just flyers. They had a full page newspaper ad, they had social media, they had bus stop information. All of the information was consistent and went together. So it really increased the number of people that were exposed to the message, but also they had audio, radio, video that's complemented this, which made sure that people understood it, even if they couldn't read or couldn't, follow text. So they used multiple approaches, persuasion, using celebrities, and this is what a good campaign does. It gets at all of those different levels to try and make the communication better. I'm sorry, I'm not looking at the chat and answering the questions right now because we have a short space of time. Hopefully Sangeeta is doing that. And if not, any outstanding questions, I will try and answer in the end. So communication doesn't equal action. That was my third point. My fourth point is this. If I asked each of you to remember a number from this list, chances are each of you will remember a different number, right? Some of you may remember 64. Some of you may remember 57, others may remember 37, but there's such a small chance that all of you will remember the same number. Agree? What if I put up this number? What is the chance that you'll all remember this number? Almost 100%, correct? What about this one? Or this one? This one? Again, different numbers. So what we're saying about this number 8 is that when you have something like this poster on the left-hand side, which is absolutely full of information in a densely packed way with a lot, I mean, it's in Spanish, but it's a lot of information densely packed together. And then you have this other piece of information, another poster on the right-hand side, which is highly pictorial, spaced out, and has very clear step-by-step understanding. Right? And it's focusing on only one thing. It's focusing on why masks can reduce the risk of COVID-19 infection. The one on the left, it's talking about different ways to prevent, but it's probably packing in a lot of information that people may say, look at it quickly, and then they look away because they can't digest all of that. So in saying everything, sometimes you say nothing, right? So less is more. Focus, demands, track, sacrifice. And then there's this concept called TBU. I don't know if any of you have heard of this concept. Probably not. TBU stands for true but useless. So all of this information on the left-hand side poster is not unimportant. It's all important, but it's not important at that moment. Like you have to focus on one idea at a time if people are to understand it. So you have to see what is true but useless for that moment. If you want to convey masks are safe, then convey masks are safe. Don't add in other information about hand washing and this and that and everything else. One piece of information at a time, done well and done persuasively. Focus demands sacrifice, or you could call it focus demands selection. It feels like, oh, I have this opportunity. I really should try and say everything. No, really don't. Because in saying everything, you sometimes say nothing. Right. So that was my fourth point, which is less is more, focus demands sacrifice or selection. The fifth point I want to make is about risk and fear. Sometimes we feel like when we talk about fear messages, it will motivate people to act. Not always. This is a cartoon which says, these are pictures of diseased lungs on my cigarette pack. They make me nervous. And the other lady says, me too. And then together they say, yes, I need a smoke. And this is exactly it, because when people, there's a theory called the risk perception theory and extended parallel processing or risk perception theory. To explain it very simply, if you make people too afraid, then they will bury that fear and pretend it's not true and continue to act the way they act, right? And if we have, what would happen if all of our COVID messages carried pictures of, people in the ICU and on drips and, like on ventilators and whatnot? the fear would make people say, hey, that's not going to happen to me. That's an extreme case. Forget about it. I'm not going to be worried about this virus, right? So increasing people's fear without increasing their feeling they can do something about it, right? That's called self-efficacy. Leads to people burying the fear, ignoring the fear, rather than acting or taking up a preventive behavior. Fear appeal can also backfire because it stigmatizes those who are infected. It can result in denial. It can strengthen fatalism, saying, okay, if you're saying I'm going to end up in the ICU, I might go in there anyway, so why bother? And it could increase risks of transmission. And how can that happen? Because people in a fearful situation may go out saying, okay, I'm going to get it anyway, so I'm just going to go out and meet as many people as possible. So risk perception should be balanced with specific doable actions that make the audience feel empowered. Because if they don't feel empowered, they're going to ignore the fear. It's important to have a little bit of fear so that people can see that it is a risk, right? But then that has to be balanced by doable actions. Okay, so the amount of fear has to be rightly balanced with the amount of doable actions. Otherwise, you risk the fear being too high and overwhelming action. And there's plenty of examples in the world out there from different country programs around HIV, around smoking, around cancer, that shows that this is true. So increase self-efficacy rather than fear. My next point is about irrational human behavior. Human beings don't always behave rationally. This guy, think safety first. He's hanging up a poster that says, think safety first. And meanwhile, he's standing in a very unsafe position himself. And if you think about it today, the brain has sensory overload. It receives more incoming data than it can mindfully process. And what that means is we wake up in the morning, check our phones, listen to our partners talk to us, listen to our children talk to us, your parents call you, you're reading the paper, you're listening to the radio on your way to work, you've got, business documents to read. There's so much data coming in. There's more data than the mind you can mindfully process. And making decisions is very hard for the brain. So the brain has evolved a way to take shortcuts for simple decision making. Imagine when you're in a supermarket and you find 20 different types of toothpaste. You don't sit and read the label of each toothpaste to see what the ingredients are, which is the logical thing. But rather you pick the one that might be the most attractive, or somebody who's told you about, the one that you've always used. So you use a shortcut, right? You don't use all the data in at hand to make the decision. This is specifically true in the COVID pandemic because so much information was coming at us that we tended to go and believe the most attractive, the one from the person you know, or the one that is repeated most often. So your brain started to take shortcuts. So this is called bias and cognitive ease. We choose what takes less effort or feels good over the option that makes us think. This is also called systems 1 and systems 2 thinking. Systems 1 thinking is reactive. You go and pick the toothpaste you've always used or the most attractive one on the shelf. Systems 2 thinking is when you actually look at every piece of information and make a choice. And this could be in something like when you're taking a holiday, right? Or when you're choosing a doctor, or you're understanding the medical outcome for something. You read and get all as much information as you can, and then you make decisions, right? That's systems 2 thinking. So when our brain reverts to systems 1 thinking very often, we need to go with that when we're trying to reach people with information. This is a campaign from Latin America, and it says, si toca salir, toca cuidarse, means when you're going outside, if you're going outside, be careful, take care, right? And that's the tagline for different aspects of their campaign. And no matter what it was, like if you're going to be dining with your family, be responsible. If you're going to work, be responsible. If you're going out shopping, be responsible. But all of them had the same tagline. If you are going out, take care. So they simplified the message. So every time you see that tagline, you're reminded this is a COVID-19 message. We need to take care, right? So repeating it, simplifying it, these are things that make systems 1 thinking more easy. So people don't always behave rationally. The next point I want to make is about framing, how we frame something. So you could frame a Rembrandt in a shabby frame like the one on the right-hand side, and people will walk past it in a hallway, right? But then you put something that your kindergarten student like did with oil paintings or finger painting, and then you put it in a gold frame like that, people will say, oh, wow, it's modern art, and probably pay a lot of money for it. This is the thing about framing. You're not lying to anybody, but what it is it's basically how you put across information. Here's an application of framing. One says frozen yogurt contains 20% fat, and the other one says frozen yogurt 80% fat-free. Which one are you more likely to get? Because both of these have very different pieces of information, but they actually mean the same thing. Content is exactly the same. Chances are people will go with what makes them feel good, attractive, and it's framed nicely, right? You frame it as 80% fat-free, people feel good about buying it, rather than if you say contains 20% fat. Masks. If you say mask, it'll protect you, it's got, infection prevention, la, 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 and make it look very sort of medical and boring versus empowering, exciting, get a different color mask for each day. We can do it. Positive framing of face masks. Can you totally change the way people look? So framing is important when you communicate. Put it in a positive, empowering angle rather than a boring or like sort of negative way. The next point I'd like to make is about equity and how people access information and services. Whether it's gender, whether it's economics, whether it's education, this pandemic has affected people not equally. And while people may say it's a virus, it affects everybody equally, no, it does not. Because not everyone is able to sit at home and isolate. Not everyone is able to avoid going out to work. Not everyone is able to afford a clean face mask. Not everyone can avoid, staying home from work. They have to go. Other times, people may not be able to get good health care that you may be able to get. Nutrition makes your immunity lower. So education makes you less able to access information. So these are things that we have to keep in mind, that we have to ensure that our approach is fair. I always like this visual because we have to understand the difference between equality, equity, and liberation. Equality means giving everybody the same supports that they need or equal treatment. And it only works if everybody starts at the same point. The equity means giving everyone the support they need to gain equal access and opportunity. And when we're talking about, whether it's like reservation or whether we're talking about, gender or anything else, we need equity to make sure everybody gets to the same place so that eventually equality can happen. And liberation, removing systemic barriers that will allow equal access and opportunity without supports. That's ultimately where we'd like to be, right? So poverty, congestion, accessibility, right? These are all things to be taken into mind when we're telling people use alcohol-based hand sanitizers. Do any of the people in this picture look like they can regularly afford alcohol-based hand sanitizers? Or do they have access to enough water that they can wash their hands with soap and sing happy birthday 3 times? I mean, when we communicate messages, we have to be mindful of the audience we're speaking to and keep these issues of equity in mind. And when we are sensitive about that, people feel like this message is for them. Otherwise, they're going to dismiss it and say, this is a message for rich people. This is a message for educated people. It's a message for people with running water, and so on. So my 8th point was about fairness. We have about 9 minutes left, and I'm going to try and finish this. I think people will have different interpretations of what this picture is. In other workshops I've shared this in, some people have said giraffe, some people have said horse and rider, some people have said it's Dalmatian, other people have said many things, but in reality, it's a collection of patches, right? I have not completed the picture, so your mind is completing the picture the way you interpret it. You're filling in the gaps per your experience, right? So when information is incomplete, people fill in the gaps in their own ways. So when we're trying to communicate around COVID, it's very important to anticipate what people might want to know about one particular issue and fill the gaps completely, not leave half information so that they end up filling in the gaps, right? So if you say something like people with fevers should come to the clinic, you've not said what level of fever, how much fever should they do, how long should they wait. So then people make up stuff, and this is how this WhatsApp misinformation starts, because people are filling in their own gaps. So complete information is really important. And finally, my last point is about pre-testing. Pre-testing checks if what we have designed, or what has been designed, is really suitable for the audience. You involve the audience when you design it, but you also go back and check in with them. Is it understandable, culturally appropriate, believable, realistic, acceptable, appealing, motivational? I mean, ad agencies do this all the time with all of their advertisements. So why don't we in public health? It can save money, time, and energy, right? So pre-testing is very, very critical. I would say pre-test, pre-test, pre-test. Do not put out any communication without pre-testing it, because you'll never know what you'll find. And at the end, just so we have 5 minutes at least for question and answers, I want to leave us with 4 resources that are available. There's the COVID Communication Network, and perhaps we can share, we can share the links to all of these with you. It's called the CCN, or the COVID Communication Network, which is the left top side, which has a collection of curated communication interventions, tools, and things from all over the world, which have been looked at for quality. So anything around COVID-19 in different languages, different countries, different audiences, you can search on this database and find a collection of them. And it's really a great resource for COVID-19 materials. Below that is the CAP, the Knowledge Attitudes and Practice website. It's a dashboard which talks about attitudes and practices around different COVID-related behaviors in different parts of the world. And this information is constantly being gathered with Facebook as a partner with Johns Hopkins. So you can find information to compare countries. How is your country doing? What is how do they believe mask wearing is effective or not? What is their correlation between their belief and their action? So all of this fantastic information for a really rich database is available at this COVID-19 CAP dashboard. Also on the right-hand side top is the Compass, which is another database for not just COVID information, but social and behavior change, communication materials, and resources from around the world on any topic. And that's something you can look at. And below that is Springboard for health communication practitioners or social and behavior change practitioners. It's like a combination of LinkedIn and Facebook for people who are doing social and behavior change. It's a great platform. So we can share information about all of these. If you want more information about these sites or about a longer course on social and behavior change, you can email us at info@ccci.org.in, and we can share that with you. So I will stop my screen share right there. And I'm sorry if I have talked too fast and too long, but I would like to have a chance to get at any 1 or 2 key issues before we close. Sanjita, do you want to flag anything perhaps that I should respond to?
Sure. So there's a question from Rashi. She's asking, what could be the best way to communicate with adolescents and young adults, gaming, humor, or anything else on topics of stigma such as reproductive health?
That's a great question. For reproductive health, there's a huge number of resources on the Compass. You should take a look at that. And I think gaming, these are all platforms where young people actually go and they believe and there's interesting ways to do it. Social reproductive health is something that is a stigmatized issue. And there's super creative ways to address young people with that in their own language, in their own ways. So I would encourage you to check out the Compass for some examples of how people have done that in different parts of the world. You can type in adolescence, sexual reproductive health, and see what kind of resources it brings up.
There's another question which says, is behavior change long-term through communications? Are there any limitations we should expect from such communication campaigns in the social sector?
Absolutely. So one big challenge we've had in communication campaigns is that the funding is always a one-off and people don't fund it for over time. And communication is a process, it's not a product. So you can't communicate and expect people to just change, right? So all communication campaigns do need to happen over time to keep behavior sustained. In Africa, we're seeing that in many countries now where HIV is no longer the key focus. And when communication has come down, HIV rates have started going up again because people thought we've done our job, it's done, it's finished. So we need to keep in mind that communication is an ongoing process. Like, do we ever feel like we all know our spouses 100%? No, it's a process of communication over time. And we never stop communicating and never stop learning how to communicate. So it is a process that needs to go on over time and cannot be a one-shot deal at all. So I thank you for raising that very important question.
One last question. What is your special message for doctors regarding communication skills?
This is hot water territory. So let me just say that knowledge experts are not always the best communicators. In a rare time, you do have fantastic doctors who can be fantastic communicators. But doctors are great at being doctors and communicators are great at being communicators. So my message to doctors would be to partner with good communicators and figure out a good way to get your information out there in a way that your audience can understand it. Because while you have the credibility, the way to do it maybe is a science. And it's a science and it's an art. So getting the right people on board to be able to help you do that better would be a suggestion that I would have for doctors, because then that will make your information, your credibility go much further and be far more effective. But we really appreciate the great work that you do, and do pair up with a communicator.
So we have 2 more minutes. Would you like to take a few more questions?
Let me ask though, Yamini, what do you feel?
I think we can take one more question.
Okay.
Okay, great. So there's a question which is asking, especially children, students are widely affected. How students should communicate in this pandemic to avoid boredom and control their anger?
I think mental health has been a real challenge during this pandemic. Finding and linking young people to resources around that would be critical. UNICEF in India, I know, has done a lot of good work on mental health for children. And there's a lot of other resources as well. But trying to keep them connected, there's a whole resource section in that. In the COVID communication network, there is something called the synthesized guidance to health messaging. And if you look for that document, it is featured at the bottom of the landing page. It has all the latest consolidated information on a bunch of different topics, including communication with children, mental health for them, and so on. And the COVID Communication Network site has a lot of resources on working with children also. So I would encourage you to go and check some of those out, because there's some good ideas out there. So maybe we will have to end there. And I thank you all for your attention. My sincere apologies for it being a little rushed. I hope we managed to get the information across in this short space of time, and that you got some things, at least 1 or 2 numbers that you can find useful in your work. And yeah, thank you very much. And good luck with the rest of the conference.
Thank you, Ms. Kumar, for a truly wonderful masterclass. I think the insights that you've shared with us today about different behavior cues, heuristics, and biases can definitely go a long way in informing our policies and mandates that we put out in regards to COVID. So thank you, ma'am, for sharing your insights today.